feel like you're drowning in paperwork? Seriously, invoices stacked to the ceiling, budget reports that just won't end.
It's a universal truth, isn't it?
It really is. But what if we could hit that fast forward button on all that administrative chaos, especially when it comes to something as important as clinical trials?
That's a question worth exploring.
Hmm.
And we're not just talking about a minor time saver here. This is about fundamentally changing how we handle the financial side of clinical research, making it leaner, faster, and a whole lot more transparent.
And that's where today's deep dive takes us. We're looking at the Global Costing Task Force, and they're advocating for something pretty radical, using automation to streamline all these financial processes.
And the exciting thing is that the tech to actually pull this off, it's not some far-off fantasy. The tools to automate everything, from budgeting to invoicing to payments, they already exist.
Okay, so help me wrap my head around this. What does this look like in reality? We're talking real-world clinical trial. How does automation actually play out?
All right, picture this. You're knee-deep in a trial. And instead of, spending hours chasing down invoices, reconciling spreadsheets manually, your budget dashboard, it updates itself in real time as expenses happen.
Wow.
No more scrambling for information, right? You've got this constant, crystal clear view of where your budget stands at any given moment, all without those pesky delays and the risk of human error creeping into those spreadsheets.
That is massive. No more waiting weeks for payments to process or trying to decipher what on earth those spreadsheets are trying to tell you.
Precisely. And this real-time transparency, it's a win-win for everyone involved. Researchers, they get a much sharper picture of their budget, empowering them to make smarter decisions throughout the trial. And institutions, think about the reduced administrative burden, which frees them up to, allocate resources where they truly matter.
It almost sounds too good to be true. Are we missing any potential downsides here?
The million-dollar question. And it's a crucial one. Look, while automation holds incredible promise, let's not pretend it's a magic bullet, right? There are always going to be challenges with integrating new systems. Data security is paramount, and ensuring that automation integrates seamlessly into existing workflows, those are hurdles we've got to address head-on.
Makes sense. Now, what about the human element in all of this? Are we essentially saying goodbye to research administrators? Are robots taking over?
I'd say it's less about robots replacing humans and more about, well, think of it as an upgrade. Automation takes care of those tedious, repetitive tasks that bog everyone down, freeing up administrators to focus on the strategic stuff, the analysis, the big picture thinking.
So instead of fearing the robot revolution, we should see this as an incredible opportunity to actually boost human capabilities, right?
Absolutely.
Yep.
Ultimately, it's all about making the research ecosystem as efficient and productive as it can possibly be.
Which begs the question, if these tools do become the gold standard, how might that change the landscape? How much faster could we see those groundbreaking medical discoveries? It's pretty exciting to contemplate.
Isn't it? Think about it. If we can bust those financial bottlenecks that always seem to slow research down, we're talking about the potential to unlock a whole new era of accelerated medical innovation. Definitely something to keep our eyes glued to.